So a hackathon is when you bring people together in a really short period of time and you build things and make things happen. So what we do at our hackathons is we bring together engineers, entrepreneurs, clinicians, designers, and scientists to hack on disruptive solutions in healthcare and medicine.
And the key is that we can validate those problems with these physicians that a lot of times these technologists can't sort of understand without meeting them. And a lot of people think that you can't hack away in 48 hours, but if you think about it, 48 hours is a whole work week. And when else do you have people solely focused on one task at hand?
And so these hackathons bring the right people together really early to focus on the needs and the design considerations, and not shy away from the business models to make something a sustainable venture.
Specifically with diabetes, I think this type of collaboration is really fundamental because diabetes is very complex in multiple aspects. I think being able to create a business case around diabetes is extremely complex because of the length of the disease. Creating a solution around the engineering is fairly unique because of the invasive nature of diabetes and managing sugar, and as well as really defining what the problem is from a clinician standpoint. So bringing the clinician, the engineer, and the business person together in one place to really brainstorm and accelerate that thought process is really critical.
And so what you have at the end of this hackathon is you have a prototype developed in a really short period of time. And yes, it's not perfect, and yes, it's not done, but it's the first step into getting this innovation off the ground to make a difference in healthcare. We have the president and CEO of Joslin speaking tonight, and we're so thrilled to hear him because he's such an important subject matter expert in the field, really driving innovation in diabetes. So we really hope this can inspire the hackers over the course of the weekend.
So I had an opportunity to explain to really the 450 participants of the hackathon on Friday the magnitude of the diabetes problem. So, just to repeat it, 382 million people around the world with diabetes, projected to go to 592 million people by 2030. So clearly we need some new solutions, new approaches if we're going to get a handle and basically stop that progression. The key is that we're really working on thinking about innovation, new ways to approach, in our case, diabetes. And we listened to all 5 companies that were presenting in that space, and we selected the one that we thought most provided the best kind of quick, interesting, kind of hackathon appropriate solution, and that's a group, MedApps Review, who really said there were 45,000 medical applications out there today in the cloud, and frankly, how many of them really provide value, and frankly, how many of them provide value for people with diabetes. So their idea was to basically put together I'd almost call it the consumer reports of medical applications that are on the tablet, on the web, that are on iPhones, and really help consumers and patients and doctors understand which are the ones that are really the best, which are the ones that can provide the biggest and best help so you can better manage your diabetes, or you can help your patients manage their diabetes. So, I think it's part of what Dr. Joslin would appreciate is, creating an environment, creating a forum where bright people that look at it from a different point of view, different perspective, different discipline, they come together, and sometimes great things come out of that lateral thinking.